Good afternoon, everyone. As everyone's just starting to filter in from the waiting room, I just want to say welcome to everyone. Welcome back to those of you who are with us this morning. And if you were here this morning, you will have heard Sequoia, our knowledge keeper and elder, open up the symposium and share her song with us. But first of all, she's not here with us this afternoon, but I would still like to say that I'm joining you today with humility and gratitude from traditional and unceded territories of the Lekwungen peoples, also known as the Wasanic, the Esquimalt, and Songhees First Nations. And I welcome everyone to add to the chat their recognition and respect for the territories on which you make your home and or work. So my name is Terry Fleming. I'm the Director for Research Ethics BC. And before we hand over to the moderator, I would just like to remind everyone that this session is being recorded for sharing afterwards. And then thank you very much for joining us for the second session of the Clinical Research Ethics Symposium for 2022. The moderator for our next session is Nicole Prestley, Manager of Research and Knowledge Translation for the Women's Health Research Institute. Nicole has worked in health research facilitation and patient engagement since 2006. She's passionate about knowledge user engagement in all phases of the research process, including ideation, operations, and impact. Nicole has formal training from the Knowledge Translation Program at St. Michael's Hospital and the University of Toronto through Sick Kids Hospital. So I'm going to now invite you to please take time to read the bios of all of our speakers that are available at the link that I believe Jessica is just going to add to the chat for us so that we have access to it. And with that, I'd like to turn it over to Nicole. Thank you.
Thank you so much, Terry. Good afternoon, everyone. And thank you to both Terry and Aoife for inviting us to speak to the Research Ethics BC community today. We're really thrilled to be here to discuss a project that's kind of centered within the WHRI called Beyond the Binary in BC. I would like to acknowledge that I'm joining you from the WHRI office at BC Women's Hospital and Health Centre, which operates on the traditional, ancestral, and unceded territory of the Coast Salish peoples, Musqueam, Squamish, and Tsleil-Waututh nations. And further, this acknowledgement, gratitude, and respect extends to all the First Nations communities on whose traditional territories the WHRI builds relationships. Next slide, please. To that end, I have the pleasure today to co-present with a wonderful team, Dr. Angela Kaida, who is a co-principal investigator, a professor in the Faculty of Health Sciences at SFU, Canada Research Chair Tier 2 in Global Perspectives in HIV and Sexual and Reproductive Health, and scientific advisor at the Women's Health Research Institute. Beverley Pomeroy, also a co-PI, is the experienced lead patient safety, quality improvement, and innovation at Vancouver Island Health Authority and an executive board member at the Canadian Association for Health Services and Policy Research and SPORE Evidence Alliance. And Julia Santana Parrilla is a project researcher, knowledge broker, and recently joined the Women's Health Research Institute staff to work on the Beyond the Binary in BC project. But has been with the project since inception. And I am the KT manager at the WHRI, and I'll be giving you an introduction of Beyond the Binary as it started at the WHRI, and then I'll be moderating the panel discussion following this presentation. So I've given you a really quick overview of my co-presenters, but they'll sort of give you a better description of how their expertise is nested within the project and project activities. Our agenda today is to just give you a sense of the WHRI's relationship to the Beyond the Binary project and a brief overview, some of the researcher lead and engagement activities, followed by community engagement, and then we'll close things off with deliverables dissemination and our panel discussion. Next slide, please. And what we're hoping to achieve with the presentation is to foster awareness of the Beyond the Binary project, to generate understanding of need for gender equitable research practices, and to activate some curiosity about how REBC members, such as yourselves, might be able to champion gender equity in research. Next slide, please. So before we jump into the project details, I'll give you a brief overview of the Women's Health Research Institute. We have a mandate that is to act as the research arm of BC Women's Hospital and Health Centre, to act as the face of women's health research for the Provincial Health Services Authority, and to support research activities designed to improve the health and health care of women and their families throughout BC and globally. Now, while we're based at PHSA and at BC Women's Hospital, we support researchers across BC and Canada, all working within the women's health research space. We have 483 members as of this morning, and they range across disciplines spanning from basic health and the social sciences. Now, in 2019, we released our most recent strategic plan, and in that plan, we made commitments to equity, diversity, and inclusion, which includes creating research that leads to improving the health of women and gender diverse individuals. My co-presenters are going to give you the in-depth overview of the Beyond the Binary project, but I want to give you a sense of why the WHRI decided to take on this work. I have the fortune to work with a communications specialist at the WHRI, and the two of us provide support to our members by reviewing and promoting their research. Now, this ranges from facilitating research recruitment opportunities all the way to disseminating research results. And in 2019, so that same year that we released our strategic plan, we had the unique experience of working with then UBC Family Planning Fellow, Dr. Michelle Chan. And Michelle was recruiting for her research project and really wanted to be sensitive to using gendered language in her studies recruitment materials. So she ended up sharing her experience with us in creating a more inclusive graphic, which resulted in several participants telling Michelle they appreciated the inclusive language she used in those materials and how it made them feel actively invited to participate. So what we started doing was summarizing Michelle's experiences and others to really showcase practical examples of gender equity in conducting women's health research. And we called this Beyond the Binary. Over the course of the following year, our team received ongoing and increasing requests, which actually expanded from just reviewing recruitment graphics all the way to reviewing data collection tools for appropriate collection of sex and gender, including a consultation we provided on the Reach BC platform, all the way to informing language in public-facing knowledge translation activities. And we found ourselves supporting these conversations, but many times without appropriate resources. Most of the resources we were pulling from were devoted to more and built for more of a clinical community as opposed to one in a research setting. And so we saw this as a real missed opportunity for the research community who were actively engaging in consultations around gender equity and language. So in conjunction with this identified gap and the obvious that the women's health research has a W in our name, and we've indicated a commitment to equity and diversity and inclusion, we felt it was important to embark on this work. Now, as you'll see from our timeline, there is nothing linear about what happened following our application for a Convening and Collaborating Award. But we did embark on this C-squared through Michael Smith Health Research BC. The goal was to understand the gap in the research specific resources and understand the future directions. So we did so, just a quick overview, by engaging existing research stakeholders who already had an interest in this work by taking a responsive, patient-oriented, and trauma-informed approach to building partnerships with community and gathering information. So my co-presenters, I will pass it off to Dr. Angela Kaida, who will give you a more in-depth overview of the researcher and the Beyond the Binary in BC project.
Great. Thank you so much, Nicole, for that introduction and for bringing us to this "we are here" point in this winding road. I did want to just start by quickly introducing myself. Nicole did share my academic background and my role in the Faculty of Health Sciences at SFU. But I also wanted to just share a bit of my identity and who I am and how I come to this work. So I'm a mixed race immigrant from East Africa, and I now am honored and privileged to reside on the unceded ancestral and traditional territories of the Coast Salish people, which includes the Musqueam, Tsleil-Waututh, and Squamish First Nations. I use she, her pronouns. I'm a mother of Gen Z and Gen Alpha children. And I bring those identities and that experience to the work that we're doing here in the Beyond the Binary project. And I will also say that a large part of our work has really shone a spotlight on just the absolute importance of language. And I myself am on a language learning and unlearning journey, if I can describe it as that. And so I'll just, offer myself up as an example of if I do use language that you find to be inaccurate or hurtful or confusing or unclear in any way today, please do stop me or correct me, and I'll respond. So I'll respond. So thank you in advance for that. And I suppose as I introduce the work of the Beyond the Binary project, I do want to acknowledge that people across the gender spectrum can benefit from research framed as women's health. However, our field has been justly criticized for almost exclusively centering cisgender women in our work and not being intentionally intersectional in our research process or our impact. And one of the serious consequences of this is that trans, non-binary, gender non-conforming, agender, intersect people are often excluded from participating in women's health research, and then are not really included as recipients of the knowledge that this research generates. And this has to change. And as Nicole outlined, this feedback and this learning has led the WHRI and our partners to develop the Beyond the Binary project. And we have this long tagline as part of our title, which you can see here on this slide. But really, it was important that the work that we pursued took an approach that was patient, or maybe more accurately, person-oriented, using a trauma and resiliency-informed approach to building partnerships and dialogue to incorporate gender equity into women's health research. And what this means to us is acknowledging that many folks have experienced harm from research. Folks have experienced misgendering, stigma, discrimination, exclusion. Folks have showed up to spaces seeking care and support, and they've been denied that care and support for reasons that are related to their gender expression, and other intersections of their identity. And this includes being excluded from research participation and benefit. And so the process of engaging in partnerships to advance how to better incorporate gender equity into women's health research must first and foremost be trauma aware, to acknowledge the trauma and harm that has been caused, and then with training to be trauma informed. And I'll just also highlight that we've used the language of being resiliency informed. And I just want to be clear that, we don't conceptualize resilience as, some inherent individual trait, like bad things can happen to you and you can still stand strong, but really resilience understood as something that's fostered through relational worldviews, through connections and support from culture, community, peers, family. And I just wanted to highlight that because I think that conceptualization is important to honor the community leadership from those living beyond the gender binary. And so with this approach, actually, Julia, just go back for 1 second. Thanks. So with this approach, and in collaboration with a large team of stakeholders, and these stakeholders include women's health researchers, of course, but also trainees, clinicians, research leaders, research administrators, community leaders, people from Two-Spirit, trans, non-binary, intersex, and queer communities, and other knowledge users. We applied for a convening and collaborating grant from Michael Smith Health Research BC. And in this application, we proposed this project, Beyond the Binary, which is a multi-stakeholder participatory project that's intended to inform guidance for gender equitable practice within BC women's health research community. Next slide. And in October of 2021, we received that funding and set out now to do the work. Next slide. So Beyond the Binary has the Beyond the Binary project has 3 primary goals. So the first goal is to establish and convene a community steering committee that's reflective of Two-Spirit, trans, non-binary, intersex, and queer communities across BC. And Bev, my colleague, will describe this goal a bit more fully. But essentially, we committed to convening a community steering committee to build relationships and trust, to guide the work that we were undertaking, and to inform decision-making about the project. The second goal was to engage research stakeholders. And in addition to strategy meetings, et cetera, we wanted to engage research stakeholders in training opportunities on the topics of gender diversity, gender inclusion, and trauma and resiliency informed practice. And our third goal was to host knowledge exchange events. And in these events, to facilitate dialogue and also to plan for the types of knowledge products that we could circulate to our community to advance gender equitable research practice. Next slide. And here's who we're doing the work with. So you can see here in the purple hexagon, the core team. We have Bev and I as the co-principal investigators, providing community academic co-leadership to the work. We're also lucky to work with an amazing project researcher, who's Julia, who you'll hear from soon, and Nicole, who's our amazing knowledge translation manager. We've also been fortunate to have trainees join us in this core team, including Maya and Sadie. And I raise that because I think in my experience, this may be the case for many of you, is that our students are very interested in work that's related to gender equity and inclusion. And they really have so much to bring to our discussions and to the conceptualization of the project. And as a core team, we're responsible for delivering on the project goals. And we're guided in our work by this community steering committee, as I mentioned, which is comprised of folks who are members of and or serve communities experiencing gender-based inequities in healthcare, in research engagement, and other spaces of exclusion. And then we work closely with a research steering committee. And this is a team that includes co-investigators, research partners, trainees, other stakeholders in research. And we really see that this is a group that really is our champions for gender equitable research practice across the province. They're committed, they've signaled their commitment to building their own capacity in gender inclusive research practice and to creating safer, inclusive, and gender equitable spaces for this research to occur. And the working relationship, actually, just go back, Julia. The working relationship between these 3 groups is actually more dynamic than it appears on this slide. There's a lot of two-way, multi-way interactive dialogue between the various groups identified in these hexagons. And I'll also just say that the hexagons kind of present, I'd say, a somewhat misleading division between the groups, in that members of the core team and the community steering committee are also researchers and researchers and research stakeholders, while the research steering committee also includes gender diverse members. So these are porous boundaries. Next slide, please. And so if I've now shared with you what we're trying to do, or our goals, and who we're trying to do it with, or our team, this slide tries to depict how it's been going. And our journey has not, and really could not, be linear. But rather we've committed to an emergent design in our work, meaning that as we've learned more and sought advice and guidance from our steering committees, we've adapted our process. But I did want to walk you through a few of our milestones. So we received funding in October 2021. The following month, we began our strategic planning meetings with the research steering committee members. And really these conversations are about, unpacking the goals for our work and determining the most valuable contributions that we could make and how we could get there together. By January 2022, we'd sent out invitations to individuals and organizations across the province to ask them to serve on the project's community steering committee. In February, the research steering committee members took the Intro to Gender Diversity training course offered by PHSA. And in March, we held our first community steering committee meeting. In May, we undertook a knowledge translation workshop. In May, we also underwent another training, this time by PRISM, which was focused on, the training was called Trans Inclusion 101. And over these months, from the spring to the summer to the fall, the project researchers and trainees were working on compiling an environmental scan of gender equity in research resources, as well as conducting a literature review to help us understand and ground our thinking in the current state of knowledge and practice in gender-inclusive research. And Julia will share more about the findings from that work. And then in June of this year, we shared early drafts of these resources at the second Community Steering Committee meeting, where the members gave us their feedback and guidance on how to refine and improve these resources. And here we are continuing that work in November of 2022. Next slide, please. And you'll see that across that timeline, engaging with research collaborators has been a really essential component of our work. And I just wanted to say a little bit more about this group. Next slide. So the research stakeholders involved in Beyond the Binary include researchers and trainees in a range of disciplines, including midwifery, OBGYN, sexual health, reproductive health, infectious disease, psychology, nursing, youth health, population and public health. The stakeholders also include leaders at health research institutes in BC. So these folks may be researchers themselves, but have a role of research leadership across these institutions. And this includes the Women's Health Research Institute, BC Children's Hospital Research Institute, and PHSA. Our research stakeholder group also includes leaders from research ethics at University of British Columbia, which has been essential to our conversations. And finally, a final group of what we'd call research administrators. So these include staff who directly support the production of research, and including who may be involved in participant outreach and recruitment activities. And essentially, this group of research stakeholders include folks who are or who can influence culture change towards more gender equitable and gender inclusive research. Next slide, please. And in terms of the activities that we've been undertaking, as I've mentioned, our first activities are really about these strategic meetings that are setting priorities, identifying the key areas where we can make an impact with our work. The second major area of activities is team training. And really the group came together to view training as essential to providing a common knowledge base among members of the Research Steering Committee. And some members had extensive prior training and experience in gender inclusive and gender equitable research practice, and others had quite a bit less. And so we agreed that it was important to start our work with a common set of training fundamentals and understanding. And so we've taken two courses together. The first one, as I've mentioned, is the online Intro to Gender Diversity course offered by PHSA. And this course introduces key terms and concepts, along with basic strategies for creating welcoming and accessible gender-affirming services. And then subsequently, we took the PRISM training on Trans Inclusion 101. And this training is focused on enhancing awareness, compassion, and competencies when working with trans individuals and communities. And then next month, we will together complete the TRIP training, which is Trauma and Resiliency Informed Practice for researchers and evaluators. And then our third major activity was undergoing a knowledge translation workshop. And I think much differently than other workshops I've done in this way, we were really facilitated through a reflexive exercise to begin. And in this exercise, we were encouraged really like to examine our own positionality, reflect critically on what we were doing and why we were doing it. And having gone through that process together, we then set out to develop what was our knowledge translation plan for this project? What were the key messages that we wanted to communicate, in what form, and to which audiences? And I'd say really that collectively, these activities have impacted our decisions to create a resource package, is how I'll describe it, for gender inclusive research practices. And I think importantly, it's moved us away from thinking that there were prescriptive rules that we could give the research community, do this, don't do this, but rather how important it was to encourage and give guidance around research team training and capacity building, reflexivity in our practice, language guidance, and encouraging community engagement and consultation in our research. And later in this presentation, Julia will share more details about how these activities informed the key knowledge products of this project. So I'm going to now turn it back to you as an audience. So I'd like to ask you a question. This is not putting anybody on the spot, but the question here is, have you engaged in any learning, formal or informal, to support your gender equitable language practice? So this is an anonymous poll. Oh yeah, we can see the poll popping up on our screen, I think, for everybody. So it's anonymous. Nobody's going to know who you are. So just share with us your experience to date. And we'll just give you, everybody, a few seconds here to put your answers in. And then I'm going to turn it over to Nicole to share with us the results. I suppose responses are still coming in.
I might ask Aoife, is it, are you the poll administrator?
Yes, so I can see that 76% have participated. At 61% we have yes. In progress is 11%, and 28% we have no.
Okay. Well, I mean, I think this is a great start, right? So as a community, a great start that folks are taking the initiative to undergo our own learning, formal and informal, folks that have started that journey, and folks who maybe will be encouraged to start that journey by the end of our presentation today. So thank you for your responses. And I'm going to turn it to my colleague, Bev, to talk us through the community engagement aspects of this work.
Great, thanks so much, Angela, and thank you everybody for having us here today. So I'm Bev Pomeroy, for those of you that don't know me, and I am a queer researcher and a patient partner engagement specialist here in the province, and a very active patient partner here in the province as well, doing a lot of work in this particular community of 2S LGBTQIA+. So I am the PI, one of the co-PIs on this project. And not just because of my work here in this particular area, but also because I am queer and part of the non-binary community myself. So having had my own experiences in healthcare, obviously I have an invested interest in sort of learning more about it for myself, but also in helping to inform the research that's being done and how we're doing research to be more inclusive of beyond the binary. So I'm super grateful to be here today. I am here as an uninvited settler person on the shared traditional ancestral and unceded territories of the Snohomish Territory, also known as Gabriel Island, a gorgeous southern Gulf Island here in BC, and it just started pouring here. So here comes our next atmospheric river. So I want to honor the elders of today and those who've come before us, and just really, give thanks to the people who've done this work far more and before I have. So next slide, please. Great. So beyond the binary, set an intention out the gate to take a patient-oriented and trauma resiliency-informed approach to building partnerships and dialogue to incorporate gender equity into women's health research. So we're super incredible that that was acknowledged in us receiving a successful C2 grant, and to have these two pieces, which I'm sure the Research Ethics BC folk that are here know how important the patient-oriented research sort of lens and framework is, but to also be including trauma and resiliency informed in this project. Very grateful that we were able to do that. Next slide. So this work cannot be done, like I said earlier, without partnerships and involvement from the individuals and communities that are impacted, nor the organizations who are providing these services and programs. So the strategy for patient-oriented research, for those who aren't familiar, is in its second round of funding from CIHR. There are 11 to 12 provincial units around the country, including here in BC, and Research Ethics BC is one of those partners. Patient-oriented research has three main goals. So it's done in partnership with patients. That doesn't mean partners as subjects or those who are actually having research done on them or with them. It's more like we're partnerships. So we're being co-PIs, we're helping to inform and influence the research questions, we're helping to theme data, collect data, support the knowledge translation activities that are going on. And again, the second core principle is it answers research questions that matter to patients. And especially when we're thinking of communities that are hardly reached or traditionally underserved, this is particularly important. And the third aim really for patient-oriented research is to improve healthcare and health outcomes for patients, which we know in particular communities is not necessarily going as we'd like to anticipate or as we've anticipated. So there's a lot of harm that's occurring both at point of care, but what we're sort of suggesting and having some curiosity is what else is happening when we're doing research to help inform point of care, and what harms can we prevent both in partnership, but also in how we're doing the research that we're doing. So really patient-oriented research is about bringing together patients, researchers, healthcare providers, and health system decision makers together on these teams, on research teams. And so our Beyond the Binary definitely is one of those projects that really highlighted and wanted to prioritize a patient-oriented research approach. And again, a lot of people that are attending today are from Research Ethics BC and understand BC Support Unit's role in Health Research BC. So I'm sure we can put some links for those who aren't familiar with that. Next slide. And so what I'm going to talk a little bit more about, and this is sort of new to the world of research into evaluation. So as we, which is a trauma resiliency informed practice piece. So as we reflect on how to support the system to engage with diverse and hard to reach populations, we must acknowledge two current realities with respect to trauma. The impact trauma has had on the populations that we want to engage with, who have experienced the most health inequities, and the impact trauma has on the healthcare workforce, in particular if we think about COVID and the overdose crisis. So if we do not acknowledge and address this trauma, we risk creating relationships and environments where people may be re-traumatized and feel unsafe. So creating further barriers for working together to improve health outcomes through patient-oriented research. So it's important to incorporate the recognition of trauma into our engagement practices through what we call a trauma and resiliency informed approach. So when a trauma and resiliency informed approach is taken, the communities we engage with will be more likely to enter into relationships willingly and trust that their safety and needs will be met. So there's growing recognition that there's no such thing as a value-free science. And we're here for research ethics. So there's no such thing as a values-free science. We're coming here with our values. We're coming here with our personal values and our work values. So what does that mean when we're thinking of ethics in particular in patient-oriented research? So if we think about that there's no such thing as value-free science, cultural, political, social, linguistic, economic origins of perspectives, including those engaged in inquiry, so researchers and evaluators, affect who is involved, what gets measured, and what gets reported. So research and evaluation activities can no longer be viewed as a neutral activity, is what I'm suggesting, as the effects of individual and collective experiences of trauma can be triggered and activated in those activities. So directly or indirectly, research may focus upon traumatic experiences or events in someone's life. It is nearly impossible to know, though, whether participants have experienced trauma related to our research or whether it may activate a trauma response. So what we're suggesting is it's good practice to assume you will have contact with people who have experienced and are experiencing trauma. And that's the framework that we went into Beyond the Binary with. That's the assumption that we made when we started to engage in the community. So in order to lessen the severity of re-traumatization, conducting research with a trauma-informed approach we know is super helpful. You don't necessarily have to be an expert in trauma studies. I'm certainly not, but it's important to possess the ability to analyze your research with a trauma perspective, to then implement the trauma resiliency informed practice in interaction with your research participants. So, we talked about, or Angela touched on resiliency earlier. I speak a lot of trauma and resiliency informed practice, and resiliency can be kind of seen as the F word lately because it is about overlaying, or it has been used to overlay more work on healthcare workers or overlay more responsibility and care on caregivers. But again, just to reiterate, what we're talking about when we say trauma and resiliency informed is about activating resiliency. How do we support the activation of resiliency in the work that we're doing? So for the sake of shared understanding, here's just one sort of description or definition of trauma, or to be trauma informed. So to be trauma informed in any context is to understand how violence, victimization, and other traumatic experiences may have figured in the lives of the individuals involved, and to apply that understanding to the provision of services and the design of systems so that they accommodate the needs and vulnerabilities of trauma survivors. So trauma is a term used to describe the challenging emotional consequences that living through a distressing event, a series of events, or set of life circumstances can have for any individual, group, or community. So in simple terms, trauma is any experience that overwhelms a person's or community's capacity to cope. So that's what we're talking about when we're talking about trauma resiliency informed practice. And I think it's also important to understand that we have trauma organized systems. So Dr. Sandra Bloom has done a lot of work in this particular area. And through her research, she's discovered that just as the lives of people exposed to repetitive and chronic trauma more often are historically underserved populations become organized around traumatic experiences, so too can entire services, organizations, and systems become organized around recurrent and severe stresses. And this is particularly important if we're looking at beyond the binary communities and what that impact can have if we're coming into those communities to do research. So in Research Ethics BC terms, our approach is to mitigate to the best of our ability harm or even reharming of communities when we partner on research teams, not just as subjects or participants, but as partners in research. So we consider the 6 principles in our engagement for Beyond the Binary. We consider the 6 TRIP principles in the work that we're doing. And so you'll see them here on the screen. So the first one is trauma awareness. So what I just talked about, being aware that there's trauma. Safety and trustworthiness. How do we do that? How do we create safety and trustworthiness with the groups that we want to engage with? Opportunities for choice, collaboration, and connection. What does that look like in your research, especially in patient-oriented research? Ask yourself, well, what does choice look like for the members that I'm engaging with? What does connection or collaboration look like? Strength-based skills building and empowerment, that's the resiliency piece. We learned and we introduced the word resiliency to TIP and sort of evolved it to TRIP a few years ago because we were getting a lot of feedback that people want it to be more strength-based. So really the strength-based piece of the work that we're doing. And then 2 additional pieces were added in the last couple of years, which are decolonizing practices. Again, what does that look like for your research team? What does that look like for our Beyond the Binary team? And meaningful involvement of people with living experiences. And that's really where we leaned into with Beyond the Binary, was meaningful involvement of people with living experiences, having the trauma awareness, the safety and trustworthiness. So just a little background, TRIP was initiated, and I just want to give a shout out to the team at Fraser Health, Mental Health and Substance Use by Marika Sandrelli. They have received funding this past year to scale up TRIP. At the same time, because of some initial evaluation results that we have, it's being cited as one of the most promising practices to mitigate stigma and bias in the opioid crisis. And in parallel, we've been piloting TRIP in patient-oriented research, and in our engagement practices are in the process of developing specific modules. So the Beyond the Binary was really an opportunity for us to look at, with curiosity, what was it like to enter this partnership with the communities that we were engaging with in a trauma resiliency informed way. Next slide, please. So with these principles in mind, the Beyond the Binary team, we set out to build those meaningful relationships among the knowledge users, researchers, patient partners, and grassroots organizations here in the province. So through our named partners that we had in the grant, we sat and had a couple meetings and discussed with them and put the call out and began to identify potential community steering committee members. Now, I say community steering committee, we actually had it as community advisory committee before, but again, language matters. CAC was not a good term. And also we wanted to sort of shift the participatory levels of those that were engaged, and rather than being advisory, which seems a little bit inactive, we then suggested we would start to use the word steering committee. So we have a community steering committee members, and they really helped us with the work that we're doing. And so once we began identifying those members, we co-created a one-pager tailored specifically for the community steering committee to accompany those invitations. So it was clarity of expectations. The team then reached out personally to those identified. We also co-created a safe space support page document to provide some tools and resources should anyone become activated through the group work. And you'll see under the slide here, so we have that as caring connectedness, and I'll explain those three how they connect together in a second. And then the CSC's purpose was and is still to collaborate with and provide their experiential and strategic guidance to the Beyond the Binary project team towards the development of project objectives. And so we have opportunities to collaborate, which is terms of reference. So when I referenced the term resilience earlier, and I said it's about activating resiliency, Dr. Werner's done a lot of work in this area, and she did a large study in Kauai. I'm just going to touch on it really briefly. And that when we want to activate resiliency, there's sort of three key processes or practices or ways of being to activate resiliency and create more and better engagement with communities we want to engage with. And so we've got it right here. So our tools for engagement were one of them, I call it rapport. It's called Activating Resiliency in Patient-Oriented Research. So what it is about clarity of expectations, opportunities to collaborate, and caring connectedness. And those three sort of key activities and ways of being, Dr. Werner has shown in her evidence, create and build and activate resiliency. So we really wanted to practically frame the work that we're doing in Beyond the Binary with the trauma resiliency informed practice. So I just wanted to sort of point out, this was an example of how we sort of operationalize that. So the one-page overview was really about clarity of expectation. The opportunities to collaborate, those were all in the terms of reference. And then the caring connectedness was really the safe space support page that we created in collaboration with the group. Again, caring connectedness. So concurrently, the project team and leadership did complete, and I think Angela mentioned this, a lot of training even before we met with the steering committee. The community steering committee is also going to be completing the 2-hour training. We're going to do it all together. So as those different areas that Angela pointed out earlier, there's different key people and key groups, we're all coming together to complete that program in December and January of this year. We're coming together to do it. But the community steering committee was comprised of those from various service organizations and individuals who have living experience. And again, we've talked about that a lot, or those who are actually involved in research impacting the trans, intersex, and two-spirit communities. So a couple examples of those were, there was a family physician whose clinical work includes gender affirming care with Trans BC and Trans Specialty Care Program, Director of Indigenous Research Center for Gender and Sexual Health Equity, Trans Care BC was involved. There's another group called Creating Accessible Neighborhoods and Chronically Queer. I see Julia put it in the next slide. And really, that's just to articulate the majority of our community steering committee are those who are transgender, non-binary themselves, and are directly impacted with the work that we're all doing. And every meeting was opened and closed by Elder Sandy Leo, and with priorities dedicated to getting to know one another and each other's recommendations for the project. So there were opportunities to mitigate the burden of representation. I'm sure a lot of you have seen that term before. So like myself, I tend to be the only queer researcher in the room. So how do we mitigate the burden of representation? So how do we suggest that? What suggestions came up around that? We really included weaving together the two spirits circle, thanks to Elder Sandy, with Beyond the Binary. And we often referenced the BC Network Environment of Indigenous Health Research and the work that they're doing. Some of the things that we learned and some of the things or the engagement practices that we really had to sort of wrap our head around, which is so hard for us in the world of research, is the need to start slow was emphasized in order to establish the trusting and fruitful relationships that we had. So Elder Sandy continues to open and close every meeting we have together as a community group. The steering committee was and continues to be a source of experiential wisdom and insight. And it really has led our shift in knowledge and how to engage better with a community of Beyond the Binary. So they've provided valuable input. I know Julie's going to speak to some of that, which has informed the draft of our 3 knowledge products to date. So the Beyond the Binary glossary, a resource library, and language matters. So we continue to request additional input on the component of the glossary. And I think this is really cool. So specifically in the example section, again, Julie will probably go over this, was that we have a chance to build out examples for the research community that reflect real life experiences. And I think that's sort of the whole point of us coming together with this project is how do we then share that? What are examples for the research community that reflect real life experiences? And really just sort of wrap up. That's why the engagement piece, we went into it with such intention and mindfulness with the group that we were working with. So I'll hand it over to you, I think, Julia, or do we have a question? I think we have a question.
We have, we'll do one poll question, just in the interest of time. Aoife, do you mind pushing the one quiz that we have? And this is really just a touch point. Let's make sure everybody's still with us. I know you had a chance for lunch before this. And we need to get you across the finish line so that we can move to the panel discussion as well. So what are the core principles of POUR that Bev mentioned? Single choice answer. We'll maybe give folks 30 seconds to complete this. And then Aoife, if you don't mind sharing those results on the screen. Patient-oriented research. That's right. Thank you, Angela. I also like what Angela said, people-oriented.
Okay, I think there's about 10 more seconds and then I should be able to share them.
Thank you so much. For those who completed it already, roll your shoulders back. Oh yeah, there we go. Look at that. 93% success rate. I mean, the other ones weren't wrong. These are principles of POUR, which is great. Okay, now we're going to shift to Julia, who is going to talk about, the dissemination and knowledge products and deliverables.
Thank you, Nicole. Thank you, everybody, for joining us today. My name is Julia Santana Parrilla, and I have been working as the knowledge broker and project researcher on Beyond the Binary. I am a cisgender, hetero-passing Spanish settler. I immigrated to so-called Canada when I was 11 years old, and as such, I'd like to take a moment to acknowledge the role of my ancestors in the colonization of what are currently known as the Americas, and my role in the accountability and acknowledgement of ongoing harms. And this is a commitment that I carry through all of my work, including in Beyond the Binary, given how gender, as we have constructed it, is a colonial construct. I will be covering what has come out of the activities undertaken so far. Oh. So as mentioned briefly by Angela and Bev, we decided to begin with informing our collective understanding of the current context. So to understand how health researchers are currently accounting for sex and gender, particularly within women's health research, we agreed to conduct a literature review. To mitigate replication of work and to increase awareness of the efforts, existing efforts towards gender equity in health research, care, and programming, we decided to undertake an environmental scan of British Columbia specifically. And to continuously scope out the barriers and facilitators to gender equity, as well as knowledge priorities, we engaged our steering committees. So the literature review, briefly. In acknowledgement of how research is a determinant of how responsive our systems of care are to population's needs, much of the literature focused on barriers to care among gender diverse peoples, as well as barriers to caring among providers. So correspondingly, calls to collect data concerning gender have been made such that future research can disaggregate sex and gender, and there can be more complete understanding of gendered experiences in healthcare. However, there is discord about the terminology used when conducting and reporting on such research. Currently, there are three main strategies being used. The gender neutral approach. So to give you an example, that would refer to people at risk of, say, uterine cancer. So rather than saying women, you would say people at risk of uterine cancer. The second being anatomy-based. So that, as explicitly said, focuses on the anatomy of a person. So people who have a uterus, which puts them at risk of uterine cancer. And then the third approach, and the most favorite approach, spoiler alert, is the gender additive approach, which explicitly identifies women and gender diverse peoples who are at risk of uterine cancer. So each of these have their pros and cons in terms of how appropriate they are. And I'll clarify these once we get to a subsequent section in my presentation. The environmental scan. So as mentioned, we decided to scope out what's kind of being done in BC already. So we checked out research institutions and centers, care and or service-oriented organizations, and professional associations throughout BC to see how they are currently articulating and mobilizing gender equitable practices. In total, 85 organizations were included in the scan. Generally speaking, as is the norm, urban centers are the most highly resourced. Additionally, and as indicated in the literature review, ongoing inequities experienced by cis women and gender diverse peoples are being responded to on the front lines disproportionately. So this includes efforts to include capacity to acknowledge, describe, and tend to gendered experiences justly, which has called for justice-oriented frameworks and approaches, from policymaking to frontline responding, capacity building for anti-oppressive, trauma and resiliency informed, and culturally safe competencies have been advocated for. So in alignment with the literature review, the environmental scan, and in conversation with our steering committees, we are developing a resource package to support health researchers, particularly women's health researchers, in their commitments to gender equitable practices. So I should clarify that we're focusing on women's health researchers here because our core leadership membership and our research steering committee membership are mostly comprised of people who are working within what is currently conceptualized as women's health research. So, and especially when we have been undertaking the strategic planning sessions, including the knowledge translation workshop, what was identified is that there is demand among the women's health research field to really understand how to integrate gender equitable practices. And as such, all of our resources are tailored to that key audience. The package is comprised of a glossary of terms, which includes the terms and concepts, their definitions, a illustrative case scenario offered by members of our steering committees, as well as references for people to continue their learning. And then the resource library has been heavily informed by the environmental scan and includes offerings for people to continue their learning or to collaborate with organizations based in BC. Both of those resources are prefaced by a section named Language Matters. The Language Matters section covers the status quo of inclusive language in health research, including the socio-historical context of language and our systems and how responsive they are to populations' needs. And then it culminates in a section called Beyond Language that emphasizes the need for anti-oppressive research practices, describes them, and provides recommendations for establishing them. In addition to these, it also includes an optional reflexivity exercise to guide researchers toward locating themselves in their research such that they can account for their influence in how priorities are set. So why does language matter? Well, the words that we use determine how well we understand people's identities, experiences, and circumstances. And when the words that we use do not accurately or appropriately represent people, then priorities and resources can be misdirected, which in essence means that the words that we use can promote or avoid harm. So that gets us to, how does language matter? The normalization of gender as a binary, as there only being two genders, man or woman, has led to the erasure of the complexity and diversity of identities that exist along that spectrum. And this binary structure has been operationalized to stigmatize and oppress many identities and experiences. This includes the experiences of women, which is why the gender additive approach that I referenced earlier is favored. It explicitly acknowledges how women and gender diverse peoples are experiencing ongoing inequities. So how does this all manifest in research? Gendered experiences and outcomes cannot be accounted for without the use of inclusive language. How we invite people, continue to engage them, and are accountable to them in the reporting of such research is predicated on language. So I'm going to invite us to ground ourselves in a little example. So you, as people who are engaged in reviewing ethics applications, I imagine it's quite commonplace for you to review recruitment materials. So here is a fictitious vignette of a call for recruitment in a study. I'd like you to take maybe a minute to read over it and identify some of the words, some of the language that could be massaged, per se, to be more inclusive of everybody who experiences pregnancy.
So I'll give folks maybe another 30 seconds to just reflect.
Please don't enter anything into the chat yet. Hold this in your mind, write it down, do whatever you need. In the next slide, we'll be starting to activate these discussions a little bit more. Now, I can't see all the attendees, but maybe Aoife, if we ask people to give a thumbs up or raise their hand function in the Zoom, maybe you can give us a sense of how many people feel like they have completed this activity and we can move on.
Yeah, we've got some thumbs up coming in steadily.
Steadily. All right. Do you think do you think it's a clear go ahead?
I think it is, yeah.
Okay, good. All right, here we go. Thank you, everybody. All right, so what I've done here is that I have bolded the cases where we have used gendered language. And I would like us to take an opportunity here to offer up some alternatives insofar as like what words could be used to acknowledge that pregnancy is not only experienced by cis women. So here I'll invite you to pour into the chat any language that you think could be used instead of those in bold. And what I would recommend is that you say, for instance, maternity care, and then like comma or equals, and what your alternative would be, or expectant mothers, same thing. Yeah, so people instead of women, yes. Yeah. Pregnancy care preferences instead of maternal care, absolutely. Parent instead of mother. People who are pregnant, absolutely. 18 plus and pregnant, yeah, could just get rid of woman, absolutely. Prenatal, absolutely. Yeah, these are all great options. And people are doing this just with so much ease. And it doesn't even require using more words. In some cases, it's using less words. Exactly, yeah. So perfect. So basically this study aims to evaluate prenatal care or even perinatal, depending on the scope, preferences among expectant parents living in Vancouver, BC. People can choose to be cared for by a family doctor, obstetrician, gynecologist, and or registered midwife throughout pregnancy. We want to know who is supporting you, why you chose them, and how you feel about the care you are receiving. To participate, you must be 18 years old and pregnant, receiving prenatal care in Vancouver. It can be that simple. Expectant parents isn't quite right, includes non-pregnant cis male partners. Oh, that's a very good flag. Thank you, Laura. Yes. So this is part of the conversation. Part of the conversation is with the language that we use, what are the implications? And when it comes to research, it really is about aligning ourselves with what is the research question and what are the research objectives. Pregnant women and gender diverse people. Yeah, we could say pregnant people, and in brackets, say cisgender, trans, non-binary, gender non-conforming, etc. You know, there are many ways that these things can be articulated. Again, it's about making it cohesive with what your goals are insofar as measurement and impact. So thank you very much for engaging in this little activity with us. I hope that it's given us something to think about. And if you would like to engage in this discussion further, I encourage you to put your thoughts and or curiosities into the Slido such that we can make sure it becomes part of our discussion during the panel. So, although we just focused on words, we ultimately need to move beyond language. What we have learned throughout the evolution of this project is that language is forever expanding to account for the diversity of identities, experiences, and circumstances in our worlds. And as such, in order to meaningfully address ongoing inequities and injustices, research ought to acknowledge its role in perpetuating and mitigating such circumstances. To do so, anti-oppressive practices such as critical reflections on gender are needed. I believe Angela or Bev are hopping back into the summary, right, Nicole?
Yeah, we were going to sort of summarize the, if Bev or Angela are available, feel free to jump in here. If not, I can continue on a quick summary.
Yeah, go for it, Nicole, other than for me to say that was my experience.
Yeah, same. I think, yeah, take it from here. And this is the timeline that I presented earlier. So I think it's just a reminder for the audience that, yeah, we depicted it this way in the sense of it isn't a linear learning process for our team either. And so, but I think there's nothing more I need to add to this, Nicole, so over to you.
Okay. So thank you everyone for sticking with us. There are 94 folks on this call. We've, taken the time to kind of really dive into what this project is about and how it's evolved. And we'd love to engage with you in a panel discussion. So I'll be moderating the discussion with Angela, Julia, and Bev. And this is really an opportunity for you to ask them questions, for you to also provide feedback. We're at this kind of interesting junction where we're developing knowledge products, and I use the royal we as though I'm I came back from parental leave in July, so they have been creating knowledge products, and we're really looking for opportunities to engage with research stakeholders, of which Research Ethics BC is a major stakeholder in health research. So we'd love to hear what your reflections are. So if folks are comfortable, definitely please, you can put questions in the Slido, and then if you're interested in a particular question, you can upvote it, which gets it to the top of the list. Or if you're feeling like you want to engage in a conversation, you can pop a question in the chat as well, or raise your hand via Zoom, and I'd be happy to moderate. So the first question we have is in Slido is, are there challenges the team faced or lessons learned with community engagement, or I imagine engaging with community? I think Bev is going to start this.
I was just going to say, there were absolutely none. No. It's hard. It's hard to engage with community in all the right ways, you know, and it's hard to engage with community in all the wrong ways. And I think this definitely, when I was joking about the squiggly line, that has been a bit of my experience with the community engagement for this particular project. We're talking about, and again, I spoke a lot about the trauma piece. We're talking about a group of people, myself included, who are consistently othered at point of care when we're receiving services. Never mind the front end of it for research. So so people are coming into these relationships already reticent, already stiff, already worried about their interaction, already worried about being misgendered, worried about being misnamed. So we're coming into these engagements already like super stressed and tight and worried. So that often are some of the challenges, and were the challenges of this group as well. So how do we do that? How do we bring people into a space and have an inviting space, you know, activate that resiliency? What does caring connectedness look like for a group of beyond the binary? It's asking what language matters to you. What pronouns do you want to share your pronouns? What does a safe space feel like? Having all those questions, you know, sort of asking and having those conversations from the outset. So it's less about the work of Beyond the Binary project, but more about, you know, we have to do the work before we do the work. And I think often we forget that when we're engaging with community. So what does that look like? It's being trauma informed, it's taking PRISM training, it's, you know, all these pieces that we have to do before we engage. I think there's so much focus on the engagement itself. We forget we got to do all this work. Even for myself, I know there's a question here about gender non-binary people, and Nicole will get to that, but even for myself, like, I learned so much. I'm queer non-binary, but my lens is still incredibly narrow. So for myself, how do I learn? So those were some of the challenges, is what does the work look like before we do the work? So we learned that along the way. And then the other challenge, I think, which might be a little contentious of me saying, but is you know, funders and those in the world of research, we're using timelines and frameworks that continue to oppress. We can't engage with a community that is traditionally and historically harmed in a same time frame as other communities per se. So it's taking a lot longer, a lot more mindful, a lot more intention to engage with the group and beyond the binary, and having longer funding time and more funding to facilitate that would be very useful. I'm going to stop there.
Yeah, go ahead, Angela.
Yeah, I mean, I just really want to pick up on that from a researcher perspective. I think, you know, there's so much work that has to go into trust building and relationship building to do this work in a meaningful way. And that is necessarily slow work. And sometimes I actually bristle about being called that it's slow. It's just, it is the pace of trust building and relationship building. There's actually nothing slow about that. And so I do agree, you know, that in terms of making culture change, like, these are not discussions or conversations that can happen within, you know, the 6 months at the beginning of the project, even though we put that into our timelines. Sorry, Michael Smith, but there is just a reality of how the work progresses. And I think also, just thinking institutionally, there's a lot of learning that has to happen at our institutions for research teams to do community engaged research. I know that we have had to do a lot of work around working with our finance departments, for instance, around how to compensate community members fairly for their contributions to this work within existing finance systems that are like just not set up to do that. How do we work together to get around that? Because, you know, every university is telling us to do community engaged research, to commit to EDI practices, to be inclusive in our work, but there's a system that's set up that is not conducive or facilitative to that. And I think there needs to be a lot of change on that front as well. So I think, you know, I really have learned a lot from the community engagement of this work in my own learning, and I benefited so deeply from my learning. And I think that the structural change at institutional and funding levels similarly has to learn about how to facilitate community engagement in a good way.
Yeah, before we move on, I'd just like to add to what both Bev and Angela have said. Something that we've been repeatedly called into by the Community Steering Committee is, did I just say Committee Steering Committee? Community Steering Committee, is for us as researchers to nurture the resilience to sit in the discomfort of acknowledging our roles in perpetuating harms, especially given how willing people within the community are to expose themselves to the discomfort of having to continuously advocate for themselves within systems that have erased their experiences. So this is part of the critical reflection necessary to locate ourselves in our research, and how that shapes our priority setting insofar as who gets included and how we include them.
Thanks, Julia. There are some amazing questions coming through. So the top one that I'm going to ask the panel next is, where most researchers have not been trained in gender equity language, what is the role for Research Ethics Board members in expecting change versus suggesting improvements?
Maybe I'll start here. This is such a great question.
Such a good question.
And it's actually a lot of what we have been thinking about as well around, I said at the beginning that about the prescriptive rules, right? Like I don't think that's the pathway for us here. I think it's about clarity. So for instance, if I share that, I'm a researcher, I do work with HIV and sexual and reproductive health. And I've thought about this a lot when I'm recruiting, when I say, oh, I'm recruiting women living with HIV, and I'm usually very intentional about trans and cis women are welcome to these studies. But do I say that in my recruitment materials, in my proposal material, like just being really mindful in my own language? So I'm bringing my researcher hat to this work, is that in the research question that I'm trying to answer, what component of my research question is informed by gender and gender diversity? What component of my research question is really about sex-based differences? And I see that Geraldine has asked a question about that in the chat. And I really think it's about being very thoughtful and mindful about what is it that my research question is trying to get at? What is the important considerations in gender diversity and sex? And so I think that in this question, what's the role for REB members? I mean, I would love to actually hear from you, because our intention and our hope is to provide this Language Matters document, this guidance that's emerging from the Beyond the Binary study to REBs and to researchers. Is that something that you could put on, your websites about, here's how to design proposals? Like, are there places like that we could help affect culture change in this way by providing those resources to the folks that are submitting proposals to your REBs?
So thanks, Angela. That's great. And perhaps I can invite folks to, what I'll do is I'll send our emails to everyone in the chat, but also if you have ideas or suggestions to Angela's point about our KT planning, please do feel free to put it in the chat, and we can save that and incorporate it into our KT planning.
Can I just, it's
Yeah,
okay, Nicole, if
absolutely,
I
Bev.
reflect on Geraldine's comment in the chat about the concern when the focus on gender non-binary people is obscuring the very real sex-based inequalities. Geraldine, that was actually probably my biggest learning in doing this project with this team. Is I am non-binary, and so I'm like, yeah, non-binary, like, let's not, like, let's keep everything the same and neutral and what have you. And fortunately, Dr. Lori Brotto is also part of this team, and has just recently published an extraordinary paper. I don't know, Nicole, if you've got the link, I could put it in too, but exactly around that, about when we are talking about beyond a binary, or we're talking about gender equalities, we have to be explicit. And that was my learning. It's about being gender additive. So it's not about muting a particular gender or muting a particular group of people. It's really about bringing everybody up, being incredibly explicit in our language, saying intersex, saying non-binary, women of color, whatever population we're talking about, being incredibly explicit in our language, because you are right, there are very real sex-based inequalities and biases in a lot of the work that we do, and in a lot of the way that care and point of care is created. So that was a great comment, and you're bang on. But it was my biggest, probably one of my biggest takeaways from this project myself, in unlearning about language and why it matters.
Thanks, Bev. And Geraldine, does that address your comment before I move into? Okay, I will move on back to our Slido questions. How have sponsors, so I guess clinical trial sponsors, been engaged as key players in the industry-led trials? We are confined by what they provide, including the language used. That's correct. So when you are acting as a trial site, I'm not sure that we have anyone from the clinical trial space or an industry sponsor on the project, do we? No. But that's a good identified stakeholder gap, absolutely. So we will add that to our parking lot.
I just want to say too, Nicole, that now there's new legislation in clinical trials. I might say it wrong, it's either I-8 or H-8. So there's an explicit direction now for those involved in clinical trials, including sponsors, to have engagement with patients and the public. So that is going to impact how sponsors have been engaged as key players in industry-led trials. So it is something that people need to start considering.
Thanks, Bev. How can we receive resources / training, etc., related to this amazing work? Do you have toolkits for researchers and organizations on how to do this work? Haha. This goes back to our, there is no, we don't have the fix it, but we can talk about future goals and resources, as well as creating a culture of reflexivity.
This, I'll start here, and then hopefully Bev and Angela can build further on what I say. Our deliverables at this point will be that package. So absolutely, there will be recommendations for places, people, websites, organizations that you can reference to further your learning on these issues, and how to integrate gender equitable practices in your day-to-day. In the resource library, that includes opportunities for training. Some places do like tailored trainings to certain workspaces and for certain audiences. So we will be eventually, once we have kind of finalized everything and made sure that our steering committees are pleased with our final outputs, we will be sharing them online, and we will be doing quite the promotional push to make sure that people are aware of them. This comes back to, I think, as Angela had kind of asked you all as the audience, like, what do you want to know, and how do you want to learn it, and where do you currently search for these things? Because based on what we get to learn about you all as an audience, we'll be able to tailor our approaches to try to make sure as much as possible that these things are not only accessible to you, but also actionable to you.
And yeah,
Thanks, Julia.
That's exactly it. And I think I've just been thinking about the previous question and this question together. And I think one of the things that we're committed to doing is trying to provide more like case study examples in our resources. So for instance, giving an example of somebody who might be doing research that is more sex-based differences, the type of language that would still be inclusive in that type of study, right? And giving that as an example throughout the resources that we're using, or another researcher who might be doing research that is really more about gender and health and how that language might look there. So in the sense of trying to say, it's not a don't do this exactly, but really trying to bring best practice examples from our research community about the type of language and recruitment approaches and data collection approaches, et cetera, that folks in our communities are using.
And I think I can just quickly speak to the TRIP work, the Trauma Resiliency Informed Practice. It is through Fraser Health, Mental Health and Substance Use, and they're doing it around the opioid crisis. We just got Health Canada funding to scale that program because it's the initial sort of evaluations have shown that it's increased sort of compassion satisfaction in the work that we're doing. We are adapting it for patient-public engagement in a partnership, and also in partnership adapting it for patient-oriented research specifically. So this team and this project was one of the teams that we really wanted to pilot the approach, but people can get hold of me or my co-lead Marika Sandarelli. We're starting a train-a-trainer program end of November, and a Center for Dialogue for Trauma Resiliency Informed Practice for those who are interested.
Thanks, Bev. The next question is another fantastic one. Do you have strategies for engaging those who have rigid sex or gender definitions who are perhaps unlikely to join a seminar like this? We could talk about our champions.
Yeah, I mean, it's a great question. It is the typical just preaching to the choir experience.
Our echo chamber.
But I mean, a culture shift requires, a champion kind of led approach. And I really, I would say even a year ago, 2 years ago, 3 years ago, like we just weren't seeing this many conversations about gender equitable and gender inclusive research. And so, I do think we are seeing a change. I know that, CIHR for several grants now requires us to complete the sex and gender-based considerations, training modules and submit certificates and work like that. So, I don't have power. I can't make anybody do it, but I think that as we start to see better and better examples, more inclusive examples, different recruitment materials that are using this language, that might be encouraging to rigid folks, as you've called them in the chat. I also think that, communities, at least in my own research program, like there's a lot of like questions that come to us from communities or folks that are interested to participate in research, really kind of creating that demand as well around like, this is relevant to me, this research is relevant to me as well. I don't see myself included in your recruitment materials, right? Like what's up, what's going on there? And so I think that push is going to come our way from the community as well. So being rigid is maybe not going to get you very far. And the questions that we're starting to have to answer for as researchers around, how diverse is your sample population, right? Who were you able to recruit? How generalizable are your results to other key communities? And so I think this is not just good practice for good practice, it's good for science. This is, the work that I think we're proposing is about improving our science, and then we're improving our service, or the implementation of that evidence into practice.
Julia or Bev, are there any comments that you wanted to make with respect to sort of our approach to, getting the word out with this work?
I think it's worth stating that this is really this is foundational work. This is one step in what is going to require a long-term commitment. And as we've stated, like, language is ever changing, our understanding is expanding, and with that we need to be able to respond accordingly. And so really, part of the dissemination of this work will also include like forming connections across, so we can and really start activating champions, as Angela has said, to introduce these conversations into different rooms and different areas of priority setting. The SFU Center for Dialogue has a really interesting guideline called Beyond Inclusion that talks about how people do not have access to areas of decision making, nor to decision making power. And so it is up to us, the people that are making the decisions and setting the priorities, to be able to introduce these considerations into these spaces. But this work is ongoing, so TBD.
I was just going to say, this really is about, I mean, we talk about the rigor of science, and there is rigor in research, the rigor of science, and yet we come up against areas like this where rigor can't exist. This is more of a developmental framework, more of a cognitive framework, and again, sort of speaking to Julie's point, this is foundational work and about doing the work before we do the work. And then it also comes from, we talked about this, from funders, from CIHR, from those that are leading these conversations, to actually explicitly make this a requirement, or some sort of knowledge or training before anybody gets access to funds or ethics approvals. So what are your requirements for an ethics approval? We have ethics on the front end of partnership and participants, but what are the ethics in partnership? What are the ethics around beyond the binary and inclusiveness? Are there ethics? Can we add ethics to this side of patient-oriented research, rather than just saying, this is a matter of integrity and value? So it really, I think, again, when we start, it's like, when you start running, you have to be, I'm just using it as an example because I started stupid running again. It's like, I can't expect to do a marathon tomorrow, right? I have a plan and I've got to start here and kind of get to the end goal eventually, but I've got to start somewhere and be explicit and create a plan and move it forward. But again, historically, science and research, really sort of holds on to rigor. And so we are having to change that culture in areas of research like this.
Yeah, it's a good point. And I mean, maybe I'll just sort of also indicate that we do, going back to what Angela pointed out in her slides with, the composition of the research teams, we are sort of, we have faith that, the number of stakeholders from the research community who mobilized so quickly to be a part of this work and have been engaged in this work is really reassuring. So there are a lot of champions out there, and especially when folks are at sort of that institutional level where they can create culture change themselves. Okay, wow, these things have changed since I looked at them last. Any thoughts on how to engage researchers who are just looking for the right answer on how to ask gender questions and aren't interested in learning? We're being hard on the researchers.
As a member of the community,
yeah.
I love this question. I mean, I think that's been a really interesting part of our process, because I think that is the question that WHRI kind of gets. It's like, just tell me exactly how to ask it, and I'll just put that in my survey. And like, we don't have to have this big back and forth about it. And so that's been a really tricky part of the work, in that's not a thing. It depends on what you're trying to do in your research. And so that's something that, I also really heard that from the community steering committee, right? There isn't a perfect question that's going to, meet all needs and satisfy everybody. That perfect question doesn't exist. So our our approach in terms of just looking for the right answer, I think is really going to be this case study, case example approach, and trying to develop, we're doing this kind of like as we speak, but trying to develop, a few different examples, case examples that we can share that hopefully other researchers can see their research in. So, if you are doing sex-based differences, here's a little case example of the ways in which this group who's kind of doing best practice have asked these questions. If you're doing more, population level research, looking at, gender inequities and experiences of, treatment access, like here's how this group has used best practice to develop and advance the language that they use in their recruitment materials, etc. And so I think, people might be unsatisfied who are looking for the copy paste, put this into my survey. But I think it's a more honest approach to the guidance that we can offer. And so if I'll even invite you, if you are thinking like, oh, this is a really tricky area, like what might be the language of this? And even if you share that with us, then we would be really excited, I think, to be challenged by a case example that we could include in our materials.
Yeah, I'd like to add also that it is really interesting, this phenomena of people being like, just give me the words so I can ask people the things, and that's it. When in actuality, it's not just about how you recruit people. It's not just about how you ask about gender. It's also like how you consider gender in your analysis. You've asked people about their gender. Now what? How do you work with that data, and how do you report on that data such that you are practicing research safely and accountably? So it really extends beyond just getting people into your research to begin with. It's about respecting them throughout the process.
And I think I'll just add to that, like from a patient or public perspective, is if like we get a lot, I get this email probably 3 times a day. How do I ask, or how do I form my demographic information to include blah, 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 blah. And my question back is, well, why are you asking that question? So it goes back to doing the work before you do the work. Why are you asking? Why do you need that information? And sort of speaking to Julie's point, if you're going to use that information, great, think about that. How are you going to analyze it? How are you going to use it? But sometimes we don't need to ask that question. And from patient public view, we're apprehensive. If someone's going to ask me my gender, my sex, and my sexuality, right away I'm going to go, well, what are they going to use that for? Is that going to be used against me? Am I going to now experience harm? So I think it's just really important. That's great. We all want to have this sort of resource for how do we ask demographic information that's inclusive, but really to ask yourself, why are you asking that question? If it's not relevant to your project in a way that matters, do you have to ask that question? So I even challenge that and have some curiosity as to why are you even asking that question? And again, sort of going back to Julia's point, then what are you going to do with that information? Because we're all curious from a public perspective. What are you going to do with my information? Is it going to impact me in a negative and harmful way? Or is it going to help inform and influence better care for me and my community?
Absolutely. This is a very practical question. So TCPS is explicit in section 4.2 on ensuring inclusion of women in research studies. What changes are needed in the TCPS to embrace broader gender diversity? It's a great question and suggestion.
I mean, this is why it's just amazing to be, in this panel space with all of you. That's an incredible question. And I unfortunately don't know how, I don't have any background in how the TCPS kind of like updates happen, who's in charge of that. But I think, maybe like we would love to have the opportunity to share our resources and our process, etc., with those involved in TCPS and bring them into this process as well. But if anybody else in this group has a better answer, like on the panel or in the audience, please go ahead.
It looks like Elizabeth has given us some recommendations, or at least clarified how the TCPS is informed, and recommended that we go to CARIB or write directly to the panel for these considerations.
Thank you, Elizabeth. Yeah, this is connecting with different communities is just so important. We did not even think about this opportunity, so thank you. I'm just going to pop back over to Slido. There are some questions about language. So one is about if similar work is being done in the field of men's health, for example, using gender neutral language when referring to prostate cancer. And another around bucket terms instead of women's and men's health. So reproductive health, would that work? Yeah, there's, I think this does go back to the, there is no one answer.
I feel like I'm talking a lot, but I love this question. I just love this question about, is similar work being done in the field of men's health? And I mean, I don't honestly know. I have not seen the men's health research community really grapple with these questions of gender inclusivity. And I think women women and women's health research are often at the sort of leading in terms of inclusionary practice and really trying to think about who's being left out and who hasn't been. But I do think it's just such a great point, because there are a lot of folks who need to be included in prostate screening, services and other men's health areas. And so I think you've given, joking a bit aside, but I think you've really sort of put to us, like, that's another knowledge translation audience, right? As part of this work, that if we're going to be gender inclusive in research, it can't only come from the women's health research community. It's got to be also the men's health research community, and making sure that they're one of our key audiences. I don't know, Bevan and Julia, if you want to add anything to that from your experiences.
Yeah, I'm not super familiar. I know in Trans BC and some of the trans work, I think there has been some considerations in that area, but again, I don't think it's a large community or body of practice, but be super open to hearing from people that have that information, and maybe again, that's another stakeholder group that we can engage with to learn from as well.
This is true. I actually was just looking up the men's health research program at UBC to see if there's any evidence of that, because I know that they're quite a prolific program, and it doesn't seem like it. But again, I think to echo Angela's point, I think given how the gender binary has been constructed and that it is a patriarchal concept, it does make sense that people within the women's, like what we currently term women's health research, are more interested in how other people are experiencing the inequities and disparities as caused by this binary, more than men who actually benefit from this structure. So that might be a little contentious to say, but that's my perception.
But it's been said. We're all human. And as we've said, we all come to spaces with our own values and opinions. And I'm just looking at the chat and noticed, so Laura mentioned a key frustration, questions without meaningful role and methodology, lack of clarity, and about what they're doing and why. both methodology and ethics require thinking about, yeah, the use of language and not just going through the motions. And then Isabel echoed that and said, yeah, there's a concern if we shut down gender questions by asking for justification, which also runs the risk of not identifying inequities for populations served by any of the people-oriented research. Yeah, does, I mean, Bev or Angela, do you have any comments? Sorry, right, Isabel, I want inclusion without unnecessary inadvertent revelation. Need significant sample sizes to identify structural inequities. Yeah, Bev or Angela, do you have any comments on this discussion in the chat?
I'm going to find an article. It's a great article that was published called Little R, I think it was, on sort of this topic of just because that population size, sample size is so small, does it mean that it's not as relevant as the sample sizes that are larger? So I'm going to pass over to Angela and see if I can find that article, because I found it extraordinary enlightening on little r versus big R, in the work that we're doing. So let me see if I can find that.
Mm-hmm. Yeah, I mean, I think that the sample size question probably plagues a lot of researchers, but we have to start. And, I don't know if this is Pollyanna, but I do think that having better gender inclusive spaces and policies and language will help encourage populations that would not otherwise feel safe to participate in research to do so. And that's kind of a strategy around improving participation by folks in communities that live beyond the gender binary. But I really feel this discussion going back and forth between Laura and Isabel about, and I guess as REB, members, like what is the role? So do you, like I don't know, I'm just saying I can just really see this frustration of you're going to see applications come in that are not gender inclusive, have not done this language. So what is it the idea to take out the questions about gender? If it's not being taken through, then we'll lose something through that process as well. So I don't have a great answer to that, but I do think that is just such an important component of this work. I wish I had some solutions for how to do that better, but I do see the frustration, the tension right at that point. So I'll just thank you for raising that tension in the chat.
Yeah, it's a great point, Angela, and it feels for the participants who are still here, it does feel like we almost want to leave you with this question to think about with respect to, yeah, what is the role of folks who are in the research ethics community with championing, this beyond the binary work? Is it you as champions? Is it an enforcing role and keeping those considerations in mind with respect to like preserving the research integrity and not excluding people further?
I'm just very, very, very sorry. It could also be, like once we have completed our resource package, like it could be something that you put onto like your roster of things that you recommend to people in your guidelines when preparing ethics applications, So some people will look over it, some people will not, but at least it's there, and it will activate some people's kind of like willingness to reflect on these things. And of course, it's not something that's enforceable, nor really is that the point. But at least it's something that can be referred to. And then so far as the sample guide, just like a little sample size, just a little aside there, like in qualitative research, sample sizing, like even a very small sample can be very meaningful as long as the quality of the data is rich and that it really lends itself to the understanding of people's experiences and where to target resources. So take that as you may, but in terms of sample size, I think, it depends on on the design as well.
I think this is the same challenge in patient-oriented research, and that often patient partners that are coming forward are of a particular age and demographic. And I know it's the challenge is how do we then engage with people, you know, beyond the binary, with different experiences, a variety of healthcare experiences, a variety of identities, this intersecting, you know, intersecting identities and positionality. And I kind of go back to what Nicole said at the beginning is, or maybe it was Angela, we have to create these safe spaces. So how are you inviting participants into your research projects? What language are you using? Like even looking at your surveys, you know, what kind of language is reflective in that survey? Are you promoting safety and trustworthiness? So how are you doing that? Where's the caring connectiveness? Where are the opportunities to contribute? Where's the clarity of expectations? What does that look like in your invitation to participate in your particular study? And again, I don't know where research ethics falls in that, but I just think those are just important key reminders that to look at the language and the words that you're using, and sort of put yourself in that other person's sort of position if you can. If not, find those members of the community that you can engage meaningfully to help inform and influence your research. I mean, now SPORE Evidence Alliance is doing patient and public initiated research. So the research that's occurring, they're funding, I think, like 10 projects per year, you know, and they're funding projects that are initiated by members of the community. So again, I think we're starting to see some of these changes, but yeah, but definitely I would just engage with those communities to find a way to use language and attract them and invite them into your work in a way that's safe and trustworthy.
So I just, before we close things up, there was a question in here about language supports for respectful demographic questions. I think Julia shared the CGSHE toolkit, which I think has some, they're building out a fantastic toolkit. So definitely check out that link in the chat. And that might help with, address those needs. And then the last question I see here, do you think it would be useful for ethics applications to ask about gender specifically? For example, are you addressing gender in this research, and how, to understand methods?
Yeah, I mean, this is reminiscent for me. I think for me, the answer is yes, but I don't know what then. I would love to hear from this poster, like what would happen after that. So if the person says yes, or they say no, or they don't do a good job, just like where do we see, what would be the next steps from there? And part of the reason I asked that is that, you know, as part of getting funding from CIHR, we now have to fill out the sex and gender considerations to kind of boxes. And so folks have come to, we just fill them out because we have to. And as a reviewer on a lot of these grants, I see those responses, and some are great, some are not great, but I'm not sure what happens from there. So I would like, is it, you still get funded if you don't talk about sex and gender? Like, it's not sure what the consequences. So I would love to hear from this poster of like, I love this idea, and then what would happen?
It's a great point, Angela. And I know that some folks have, you know, part of this ethics community have been a part of the that new KT component of research ethics applications. So, you know, that's a great place to think about how the results are being disseminated and to whom. I do sort of want to maybe just be a bit cheeky with our last few minutes. And, you know, I really appreciate everyone's time here today, and see if, you know, Terry, thank you for agreeing to share some of our resources once we've compiled them. I'd love to just get even just a hand raise or thumbs up for folks who like, are you interested in hearing more about this? You've stuck around for a solid 2 hours almost. And, you know, hopefully that means that you could be a champion too. And I'll send, so if you are interested, give us a thumbs up, and I'll send a link in the chat for our project website, which also has more information about the team, and yeah, a little connected blurb. All right, I appreciate that. Thanks, everyone. So thank you so much for having us here today. And yeah, we're really hoping to be invited back and to give you an update, and please do connect with us outside of this. We're, yeah, to go far, we have to go together, right? So, and we're going slowly at a meaningful pace.
Well, thank you so much, Nicole. And thank you to our expert panelists, Angela, Julia, and Bev as well. Wonderful presentation. And it is really great to hear of the work that you're doing, not only with this project, but just to see how you've engaged with this group today, and all the questions that you've had, and the engagement here is really encouraging to see as well. So yes, we do want to hear more from you. We do want to hear more in the future. We have other forums where we can invite you back to give us some more updates on how are things going for your project and what the next stages are. And also, I know people can connect directly with you. So just want to say this brings to an end our first day of this Clinical Research Ethics Symposium for 2022. And just want to remind everybody to please complete the feedback survey for this session. I think a link is going to be added. Thank you. Rachel has added the link in the chat for us. And for those of you that are going to be there, we'd like to see you all again tomorrow, because the next session is going to be a great one as well, for working with clinical research coordinators, where they're going to be talking about ethics, taking ethics from theory to practice. And that one starts at 10 a.m. tomorrow morning. So we're looking forward to seeing you there. And once again, thank you to everyone who participated today, for the great audience, and as well for our speakers and panelists. Thank you.